Welcome, everyone. My name is Jennifer Tobin, and I am the Deputy Administrator of the Natural Hazards Center here at the University of Colorado Boulder. I am so excited to welcome you all to this informational question and answer session for our fourth special call for proposals for our Public Health Disaster Research Award Program. And before we jump in, just like to take a moment to thank the Centers for Disease Control and Prevention, as well as the National Science Foundation for generously continuing to fund this program and allowing us to support this groundbreaking research by so many amazing scholars. Hopefully, many of those are on the call today. I'd also like to thank Center Director Lori Peak, as well as research associates on the call here, Megan Morty and Rachel Adams, for all of their hard work to help build and administer the Public Health Research Award Program and make all of this possible. We're so very proud of this program and the many ways that it's already contributed to improving public health knowledge and practice in so many underserved communities. And we look forward to what this next round of proposals is going to bring. Next slide, Rachel. Okay, so our main objectives today will be to, one, provide a brief overview of the Public Health Disaster Research Award Program for those of you who are new here. We're going to talk to Tracy from the CDC, who will give us a little overview and background of the support for this program. We're going to review the current special call so you know all the details. We're also going to offer a little advice for how you can construct a successful research proposal and what the details are that we're looking for here. And then we're going to save some time to answer any questions you have. And then also at the end, hopefully we'll have a little room for discussion about connections and possibly building potential research collaborations if everybody's interested in that as well. And just so you know, this meeting is being recorded, so we can post it back to our special call page for anyone who could not attend this in person. And I invite everyone to put questions in the chat box as we move along so we can make sure and answer those when the Q&A part of the session starts. All right, next slide, please. Okay, so the Public Health Disaster Research Award Program was first established in 2020 and is generously funded, like I said, by the Centers for Disease Control and Prevention and the National Science Foundation. This is one of 4 research award programs at the Natural Hazards Center. And to date, for this program, we've released 3 special calls and 1 continuation award. Our first call was broadly open to people interested in conducting public health disaster research in the United States territories. Our second call was focused on research in U.S. territories still, but then we expanded it to be more specifically geared towards strengthening community resilience in this area. And then our third special call expanded the regional focus to include both tribal nations and rural communities across the U.S. And then as a new aspect of our program, we also invited awardees from calls 1 and 2 to apply for the continuation award, which focused on extending that previous work. They maybe needed a little more time and or money to continue. And so to date, we funded 40 unique projects, and you can read those final reports and other research products on our website. Rachel will drop the link into the chat, and so you can go and see what's been produced already in the previous special calls. And so now I have the great honor of introducing Tracy Thomas from the Center for Disease Control and Prevention. Tracy was really the mastermind of this award program and has worked hand in hand with our team since the very beginning to develop and guide the rollout for each of these special calls and the continuation award. Tracy is a senior health scientist in the Office of Applied Research at CDC, and we are so lucky and thankful to be able to work with Tracy for this special call as well. So Tracy, over to you.
Thank you, Jennifer, for that gracious introduction. I don't know about being the mastermind. It is very much a team effort and collaboration, and we are very grateful for the support that NSF and NHC provides to really make sure this program is a success. Again, I am Tracy Thomas in the Office of Readiness and Response at the Centers for Disease Control. And on behalf of our senior center leadership, including Dr. Robin Solar, who is our program director, I really would like to welcome you to this Q&A session. As Jennifer mentioned, we launched this program about 3 years ago, unsure but very optimistic about strengthening and extending training opportunities for investigators who are conducting research in underserved communities, including the U.S. territories and now rural and tribal communities. And while there is always room for more work to be done, we are ecstatic on the accomplishments of this program, even in the short time span of 3 years. And your attendance here today really reinforces not only the need for the work in these communities, but the potential for this specific program to make an impact. As you think about your proposals, I encourage you to consider two important factors. First, consider the public health implications of your work. While we appreciate and encourage a multidisciplinary approach to the projects, we want you to think about and consider how the findings, conclusions, and results of your work directly impacts the health and well-being of communities and populations, specifically in the U.S. territories and rural and tribal communities. So that includes considering influences on public health outcomes, influences and impact on public health policy and practice guidance, public health promotion, health equity, and many, many more. The second factor I would like for you to consider when you're developing your proposals is consider leveraging existing tools. Far too often in public health research, including emergency preparedness, there is a desire to create new tools, new toolkits, or new index. And a lot of that desire is driven by inefficiencies and gaps in the existing tools. And yes, while that may be true, there's an opportunity to really advance our understanding by using these existing tools, testing them in specific populations, and really looking at how those tools may be adapted to specific communities. And how, we can learn more lessons about those existing tools, because arguably it's more cost effective and it really provides an opportunity to strengthen the evidence base of what we know. So with that said, again, we are really excited about supporting a fourth year of the special call. I encourage you to look at projects that were funded in the past that are available on the Natural Hazards Center website. We are very appreciative of your interest in this program and your strong desire to continue to advance what we know around public health emergency preparedness and response in underserved communities. So again, thank you for your time today. And with that, I'll hand it back over to Jennifer, and we look forward to receiving your proposals.
Thank you so much, Tracy. So now I'm going to provide a brief overview of the special call that we're having right now. So for this special call, we're supporting, as Tracy said, public health disaster research in the U.S. territories, tribal nations, and rural communities. And the reason we're focusing on these three areas is that disasters do disproportionately impact these areas, yet they do remain understudied. And so to address these gaps in literature, we want to fund research needed to really develop the evidence base to improve community preparedness, resilience, and public health response to disasters in these areas. And this special call is designed to really address all of these gaps in knowledge. And so we encourage proposals that are really focused on improving, the public health implications of their work. So we will fund 3 to 6 awards, the amount of $25,000 to $50,000 each. And in terms of pre-proposal requirements, the lead investigator on the team in advance of submitting a proposal must meet with me for a brief 15-minute check-in to where we'll kind of discuss your ideas and make sure they're very much in line and eligible for the award. And then in addition to setting up that 15-minute meeting, we're asking that all lead investigators complete the Converge Public Health Implications for Hazards and Disaster Research training module, which is available on our website. And so while we encourage all team members to complete this, it's actually a requirement of the lead investigator when they submit their proposal. So in terms of key dates, the deadline to submit your proposal and your pre-proposal requirements is 5 p.m. Mountain Time on September 29th. And for those who are funded, one of the deliverables will be a 20-page double-spaced report that summarizes the project activities and the results. And a first draft of that will be due on April 5th, 2024. So I really wanted to emphasize that this really means there's a short timeline to be able to conduct the research. There's only about 5 months between the time that the awards will be announced on October 25th and when the first draft of the report is due. So definitely keep that in consideration when designing your studies. All funded researchers will also present their findings at an internal meeting on May 7th, 2024, with representatives from the CDC, the Natural Hazard Center, and other award recipients, during which they'll get feedback on their public health implications and other aspects of the report. And then awardees will also participate in a final public webinar where they'll share key findings and lessons learned, which is scheduled for August 1st, 2024. So in terms of some key considerations when writing your proposals, as I mentioned, make sure you have a very clear time frame and that your timeline is very clearly outlined in your proposal, because this is a very condensed timeline in order to be able to accomplish all of the research and deliverables. And just so you know, because of this short timeline, researchers may actually need to begin collecting data prior to the funding being released, because it can take also some time on our end to get that all settled. However, data collection cannot occur until IRB approval is received and sent to us. And we have developed guidance for receiving IRB pre-approval for disaster research. Our director at the center, Lori Peak, has published an article that specifically talks about that. So if one of Megan or Jen could put that in the chat, it's very helpful. And then also in terms of requirements, the lead investigator must be from an academic institution based in a US state or territory or a tribal nation. And then finally, award funding can be distributed up to 5 people, including the lead investigator, co-leads, project assistants, or other local collaborators. And the payments will actually be made directly to the award recipients, not through the university, because we don't allow for overhead, which means that the awardees will be solely responsible for all tax ramifications. Now I'll hand it over to Megan.
Okay, thanks, Rachel. Hi, everyone. My name is Megan Morty, and along with Rachel, I am in charge of helping all of you develop your proposals. So I wanted to say, first off, you're going to have a wonderful meeting with Rachel. She's going to help you answer. She's going to answer a lot of questions for you. But if you're coming out of that meeting, you still have questions, we are always available by email to answer any questions you may have. So please make sure you send us those, and we're happy to help. I also wanted to emphasize, starting out, we have on our call for proposal page, we have this whole list of projects that we are focusing on, kind of priorities for us at this point. But we want to say straight first, kind of re-emphasize what Tracy said at the beginning, is that we are looking for proposals that really demonstrate they have a strong public health impact, an impact on practice. So when you're developing your proposal, we want you to think about these areas, but also think about the ways that you can really frame the public health impact of your research. So the list we have here on our call for is also on our call for proposals page, so you can read along there later, but I will go ahead and go over some of these right now. We are looking for proposals that are focused on public health emergency and disaster risk communication for populations with access and functional needs. We're also looking for proposals with looking at evidence-based practices for public health departments, ways to improve equitable communication, collaboration, and risk awareness before, during, and after disasters. If your proposal if your research is about quantitative analysis of strategic, tactical, or operational aspects of public health emergency response, that is also a priority area for us that you might be interested in developing a proposal about that. Assessment of whether public health emergency preparedness or practices are effective and can achieve desired outcomes. As Tracy mentioned earlier, looking at those existing public health tools and products that support disaster preparedness and response practice. That may be something you want to develop as a research proposal. And then we're also very strongly interested in this call of research on ethical and equitable partnerships with representatives of local public health departments, community-based organizations, and Indigenous communities. This is not a comprehensive list, so if you have a different topic, that is okay. But as I said earlier, what matters most is that your proposal demonstrates how your research can directly impact public health practice. The Converge module that Rachel mentioned earlier can help you do this, and she will definitely help you develop that part of your proposal in your consult call. And when you're writing up your proposal, this is kind of what you want to focus on when you're developing the broader public health implication section of your proposal narrative. Okay, Rachel, next slide. All right, so then these are the other aspects of really strong proposals that we are looking for. So the first one is that it's rapid, and this is kind of going back to what Rachel was talking about as far as that timeline. We're looking for projects that are short-term in focus. They're focused on collecting perishable data or using existing data. So in your study design section of your proposal narrative, you're going to be asked to write about if you're using perishable data or existing data. I really strongly encourage you to look at the Converge training module we have on that topic, as well as an article that is linked on the call for proposals page that will help you develop this discussion in your proposal narrative. We are also strongly interested in projects that are interdisciplinary and convergence oriented. So that means applicants must demonstrate how their project is advancing convergence oriented science. We have an article on our website that will help you develop that section of your proposal. So I encourage you to read that. And then in your proposal, you will be writing a 250-word disciplinary focus statement. So that's where you're going to explain kind of the interdisciplinary, the disciplinary backgrounds of each of your research team members, and also how you're going to be bringing them together as a whole to work to study this problem and identify solutions. Another aspect that we were looking at is research proposals that demonstrate that their team members have population-specific geographic and cultural knowledge and connections of their research site and research population. So this, that's just really important to focus on that. I skipped one there. I skipped the collaboration with local public health departments. So since this is the focus of this call is on community-based research, we can't emphasize enough that you demonstrate a clear plan for how you're going to partner with your local community-based organizations, public health departments, and other community groups. And then to go back to the population-specific geographic and cultural knowledge and connections, we're really looking for, we're really interested in teams that can demonstrate that they have like a history of working in the area and the geographic location. This is something you'll want to emphasize in your disciplinary statement and also in your ethics statement and your proposal. And we have a Converge training module on cultural competence in hazards and disaster research that you might want to check out that can help you develop those parts of your statement. Next, we would like you to demonstrate how you're going to be transparent with your research instruments. So here at the Natural Hazard Center, we are working closely with DesignSafe to help people publish their research instruments and their data so that other researchers and public health practitioners can use that. So at the proposal stage, we want you just kind of to think about, okay, I'm going to build this into my timeline. I'm going to have time in my research process where we're going to publish these instruments for other researchers to use. So just kind of build that into your proposal and think about and mention in your proposal how you're planning to do that. Once you get to the actual publishing the data instruments, we can help you do that too. We are also interested in proposals that include team members who are students or early career researchers. So we definitely welcome, this is not a requirement, we welcome applications from investigators at all stages of their careers, but we do prioritize those that involve students and early career investigators. Students are also, PhD students and master students can also apply to be lead investigators, and we have more instructions and more, if we have questions about that, we can answer questions. And finally, we are interested in projects that utilize the social determinants of health or health equity lens. And that's it for me. Now we're going to open it up to questions and answers. Thanks.
Thank you so much, Megan. So let me revisit what we have here in the chat, but I do encourage you all, if you have any specific questions about eligibility or anything else you may want to ask while we're here, please do place those in the chat. Sorry, I'm just pulling up here. So I see there was a question here from Jennifer Lund about university waiving all requirements for indirects, but Jennifer Tobin has already quickly responded and said, unfortunately, no, even if all of the indirect funding is waived by the university. It cannot be sent to the university to be dispersed to the researchers. This is unfortunately just a requirement of the funding mechanism. And so really only funds can be sent directly to individuals, up to 5 individuals in total. And the individuals are then responsible for the tax ramifications.
Rachel, do you want me to go through and answer all the financial ones? Because there's a lot about the actual financial processes, and then I left the other ones that are related to the content of the proposals for you guys. Do you want me to just go through real quick? So if you haven't read the comments, I'll just go through the ones that I've answered online. And so one of them is by Chris, and it says, are person-centered environmental and other hazard outbreaks eligible for research or only other natural disasters? We definitely accept proposals on any type of disasters, but the only exception is that we won't accept a proposal that's only focused on COVID. If it's focused on COVID, it can be a dimension of your report or your proposal, but it can't be the entire focus. There does have to be a disaster included, but the definition of disasters can be more broadly expanded to include other environmental hazards as well. And so, like Rachel just said, also, the funds can only be sent to a university or only be sent to an individual and not directly to universities. And along that line as well, we had a question about if you have an auxiliary affiliation with the university, does that count, or does the lead investigator have to be like a professor at the university? And I think that's a one-on-one basis kind of question, because it really depends on what your affiliation with the university is. There's a lot of reasons why the lead investigator needs to be at a university, and it's kind of a lot about that IRB oversight and what the university standards are for their employees. And so we want the research to be conducted underneath a university that has an IRB where you would be able to get approval. So we'd have to look at that a little bit more closely. There's another question about non-academic organizational partners being the ones that receive the money. And so how it works, like we said, the lead person has to be from a university. The individuals get funds. It could be split across up to 5 people. So if you get a $50,000 award, you can decide how much goes to each person up to 5 people. And so in terms of having organizational partners, that's totally fine. All 4 other people can be organizational partners. They can be non-university affiliates. They can be from any location in the US or somewhere else. But in terms of receiving all of the money of the award to the one organization, like if you're trying to run it through their organizational tax documentation, we would have to talk to you on a one-on-one basis, because we cannot guarantee that. It's something that we would have to submit through the University of Colorado, and then they make those tax determinations. So we have seen that be able to work before, but we cannot guarantee it, as we cannot offer tax advice, unfortunately, to people. And I think that was all the...
There was a follow-up here, Jennifer, from Liz. You said she had asked originally, can the lead investigator have an auxiliary appointment? And then you had said, well, we'd have to look more closely. And then she responded, yes, directly and also through several established collaborators at the university who may participate in the project. So an alternative would be for the PI to be at the university, but they would likely receive a minority or potentially no funding for their contributions.
Absolutely right. Actually, that's totally fine. If you want to assign the person who has the true appointment at the university as the PI, they don't necessarily have to receive funding. That could be distributed across the other 4 people. They just can claim that PI space as well in the grant, so that we know it's like ran through on the award. So it's ran through the university IRB and everything.
Okay. All right. So I'm just going to go now to the top and see some of the content related questions that have yet to be answered. Okay. So there's a question here. Does the relationship between outdoor high temperature and public health meet the requirements for public project application? So definitely extreme heat, I would say, definitely constitutes as what we call a hazard or disaster, has very important implications for public health. So the answer being yes, just make sure to clearly frame that from like a public health perspective in trying to explain how, for instance, in your literature review proposal, looking at past literature that specifically examines extreme heat and the public health implications of that, and definitely exploring that within one of the kind of 3 target areas, either rural, tribal, or the US territories would definitely be eligible. And then there's another question here. Would a project aiming to encourage members of certain rural communities to get the flu vaccine qualify for this grant? I don't believe so. If anyone else wants to jump in. I mean, the flu, given that it's kind of like an endemic virus that we have every year, it doesn't quite constitute really a hazard or disaster traditionally in the sense, which is what the funds are allocated towards. I don't know if you want to add anything there, Jennifer or Megan.
I would just say that how we typically think about hazards and disasters, where there is a broad definition and we do include a lot of different things, it really is about community disruption, and disasters really should be at the scale, the focus of this proposal should be at the scale of some kind of major community disruption. And so, like I said, aside from COVID, even though that was a huge world disruption, it can't just be on COVID, but other disasters do have to have some kind of major community disruption. And I think flu vaccines would probably not fall into that.
Mm-hmm. Yeah, that's more kind of just regular public health prevention. And then here, there's a question from Christy. Would there be an interest in qualitative exploratory research? I feel the priorities lean towards quantitative methods. For example, tribal liaison perception of public health community collaborations. So we definitely encourage qualitative exploratory research. You know, we do prioritize research where there are findings that have important impacts that could then actually be implemented. So in terms of like guiding public health policy and practice. So as long as your research is able to do that, we're definitely open to those types of proposals. Also, we encourage, mixed methods approaches if there's possibility to be able to kind of look at both, the same problem both quantitatively and qualitatively, but in the past we've definitely funded qualitative only proposals. So that it's definitely.
I would like to also add to that, Rachel. And then we love qualitative research, and so the only stipulation we have is that deadlines do have to be met that are outlined in this award. And sadly, we know that qualitative research sometimes takes a lot more time. So as long as you can justify your qualitative research, that you can actually do good research in the amount of time that we have, then we fully support that. But we can't offer extensions on deadlines or anything because qualitative research takes longer.
Yeah, thanks, Jennifer. So here's a question. Must the students be in the United States be part of the funded project? I don't, Jennifer, do you want to take that one? That's like a...
Okay, so with international scholars contributing, if they're receiving funding, it can be very difficult. And so I'll just say this, we're not allowing it, but there are much larger tax ramifications for international recipients of award money. So that's just something to consider. So even if you hire somebody maybe with different funds and then use this award money to fund a different aspect of the project, that might be one way around that. You're definitely allowed to do that, but the financial, the money gets reduced through taxes a lot more if you're an international scholar, sadly.
Mm-hmm. And then here is a question here. Actually, this is posed really more for the group than for us as the administrators. From Muhammad, who actually met with yesterday. He said, is there a social scientist from the US academia interested in proposing wildfire projects as a lead investigator? And so he's provided his contact information. And so I did want to say, in addition to Q&A, if you are interested in potentially finding someone who's currently on the call to collaborate with, I please do encourage you to put your information, put a little brief description of your project in the chat, and hopefully you could link up and see if you can find some potential collaborations for this proposal. We have another question here. In a community-based research, how big is the community size to be collaborated? For example, will only one school or one organization of a senior community be possible process the study? So I would think that it really depends also on the methods that you're doing. So typically, when you do quantitative research, you want to be able to at least do enough, have a large enough or more generalizable enough population to make kind of broader understanding and recommendations for a community. If you focus that, in a very small, specific community that isn't like others, then it might not be as strong. But having said that, we definitely don't limit the size of the community, particularly when it comes to qualitative research. Oftentimes you do want to look a little bit more focused and small so you can get more rich information. But again, like there's not really a yes or no answer to that question. It really depends on how strong the proposal is, whether you're able to answer the proposed research questions, and whether there actually will be applied findings that could then be used to, guide public health policy and practice. Here's another question. Does work that focus on measuring planning outcomes regarding social determinants of health qualify, even if I have a policy program assessed does not have public health as its only goal, but rather resilience more broadly? So assuming that this is also tied to hazards and disasters, yeah, definitely. It doesn't, many of our researchers are not coming from a strictly public health lens. We've had in the past people who've worked, who are, attorneys, who work at community-based organizations, who are not public health focused, but that doesn't mean the research itself doesn't have important public health implications. So as long as you're able to make that argument very clearly in the proposal, that doesn't mean you're not eligible. And so just making sure to really emphasize the outcomes of the work, and obviously make sure there's a tie to hazards and disasters as well.
Yes, and to add to that, even if the program is broader than public health and focuses or includes resilience more broadly, the emphasis of the project should be on the public health aspect of that, just to add to that.
Thank you, Tracy. Okay, another question here. If a service is utilized, does every member of the support service organization have to be named in the proposal, or just listing of the organization? This is related to accessibility and communication issues. I guess I'm a little bit confused about the question. So do you mean you're like, in terms of like you're partnering with like an organization in the proposal?
Kelsey, do you just want to jump on and, or Kelsey, if you just want to jump on and ask your question to explain a little bit more?
Yes. Well, basically, I'm looking at communicating with predominantly the deaf and hard of hearing community, and so in that we're going to need interpreters and other services just to be able to communicate in general. So I was wondering, do I need to list the interpreters, for example, specifically by name, or can I just say this organization will be assisting us with communication of data collection?
Are you meaning like if you put it as like a line item in your budget of needing funding for the services that you're going to be requesting?
I'm sorry, I could say that one more time.
Are you asking like in terms of a line item in your budget, like if you're saying like we're going to be requesting funds to utilize these services from this organization?
Yes, ma'am.
Oh yeah, I think that's totally fine. If you just want to put the name of the organization, you don't have to name individuals who will receive that funding, just that you're gonna, because essentially the funding would come to you and then you would be able to pay for the services that you need to complete the research. And so that's totally fine.
Okay, thank you.
We have another question here. As part of our CareDex project, which is, I guess, funded through the NSF, we created a nascent stage outcome that we call Dylan a Can. Our populations of senior living facilities, as they are required to run disaster response scenarios such as tornadoes, et cetera, annually. The public health impact is a more resilient senior population. The portal prototype, there's a link here. Would developing this with our SLF community, senior living facility community partners be something within the scope of this opportunity? We would study both qualitative and quantitative readiness and efficacy of response as a result of drills and scenarios. I believe so. Jennifer, there's not like a requirement for this call, just to kind of clarify with you. You don't have to be studying an acute disaster. You can kind of be building more of like a resilient system. And so obviously, preparedness and planning is completely eligible.
Yeah, absolutely. And these kinds of questions that are really project specific too, like that's why we have those meetings with Rachel for 15 minutes, just so you can really flesh out the details of your particular project. If you have questions about what parts of it to highlight for the proposal to be successful. I think that's a good place to really kind of dive in a little bit more depth, because we just don't know the full background of this project yet. So we'd have to read a little bit more about it to tell you, give you better advice here.
Thank you.
And I will add, some of these questions are reminding me, if the success of your project is really, contingent upon certain groups collaborating with you, you may want to get a head start in establishing those connections and relationships, and maybe even having a commitment letter from those, so that as the reviewers are looking at your proposals, they'll feel more confident around the success of your project, because you have already established that whoever will be part of your project is committed to participating. So that will be important as well, and really weigh in the decision.
Yeah, and also to build on it too, I do love the idea that you're explaining here, Christopher, because I think that given that there is a short time frame, sometimes building on previous projects to kind of emphasize those public health impacts and kind of carry it forward is a really great way to utilize these funds in a shorter time frame. So I love the idea of building on something that's already going there.
Definitely. And there is another message here about a potential collaboration. So Suzanne Frew, whose expertise in risk communication, cultural competency, and equity, is very interested in teaming up with a research team. So she's extensive experience with moving research into practice and would love to join. And then her information is provided here through her LinkedIn. So unfortunately, she couldn't be here today, but if you are looking for a potential collaborator with those skills, do contact her. And I see here, can you link with the meeting? Yes,
I'm doing that right now, Rachel.
Okay, thank you. That's a little hard when it's open. Let me just actually stop the share. A little easier to see everyone. Are there any additional questions that people would like to ask while we're here?
And also, you're welcome to come off of your on mute if you just want to ask it directly to us as well and not write it out if anybody else has additional thoughts or questions. Okay, Rachel, do you want to move to like the collaborations part of the conversation?
Yeah, again, that's just what I've kind of already said, just encouraging those who have an idea and want to collaborate with others who are on the call. Please feel free to provide a brief description of the project you're thinking about in the chat and in your contact information, so that others who are interested in collaborating can contact you and you guys can talk after the call.
And all of the details of this special call are on the website too. So if you can read through those in detail, and you can always let us know if you have additional questions too. You can email hazards or has.researchawards@colorado.edu. And we can always answer specific questions that way too. But we'd be happy to hear more from you now since we have more time if anybody has more questions. Oh, there's one that just came in. Oh, go go ahead.
Are there any restrictions for a PI to support their time with other funds and distribute the entire award to community partners? Definitely not. No, I mean, in fact, if you have already funding and you want to, expand this project and be able to kind of seek funds to be able to fund your community partners, we definitely encourage that. We just want to make sure that, you're able to complete. If this is part of a larger project that's perhaps on a different deadline and you have different responsibilities for that other funder, that you're also able to deliver upon, at least part of that study based on our requirements in terms of deliverables and all the due dates. And then there's a question here, can the funds cover the cost of running a survey? And yes, then if that means participant incentives, or if you require funding, in order to be able to operate a survey software such as Qualtrics, then yes. And for those who may not have seen Christy's message here, hi all, I work with Disaster Resilience Learning Network, a network for and by disaster leaders of color. We work on wildfire resilience, trauma, and burnout, inclusive risk communication, and cultural restoration, community resilience strategies. Let me know if you'd be interested in partnering up. And she provided her email.
Thanks, Elisa. So it looks like people are starting to drop off because we're not getting very many more questions here. Thank you all for participating today and coming on and asking questions. Feel free to reach out if you have any additional thoughts. Thanks, Christopher. Bye.
Hi, Lori.
Hi, that was great. Great
Hi.
turnout and great questions. Thank you.
Go Buffs.
Hi,
Thanks, Lori.
Tracy.
Hello. How are you?
Good, thank you.
As always, your team did a great job.
You're amazing and wonderful to see the interest in the call and people looking for collaborations and everything.
Yeah.
And Tracy, we know you cannot join the next call with the back-to-back calls, but do you have any requests for the discussion with the continuation award recipients or anything you want to see shared there?
No. I know they sort of know the routine and know what we want. So they're in good hands with you guys.
Awesome. Thank you, Tracy.
Yay, thank you. Okay, we'll see you all in a little bit then.
See you
All right.
soon.
Okay,
All right,
all right,
take
bye.
care.
Thank
Bye.
you.
Bye.